Okay, Julie, I think you could begin.
Yep, just thinking the same thing. Hello, everyone. Welcome to Patrons Experiencing Homelessness Policies and Parity, hosted by the American Library Association's Social Responsibilities Roundtable, or SRRT. SRRT believes that libraries and librarians must center social responsibility by recognizing and helping to solve social problems and inequities to work for the common good. My name is Julie Ann Winkelstein. My pronouns are she, her. I'm speaking to you from the unceded territory of the Muwekma Ohlone people in California, and I'm currently stably housed. I'm your moderator for this session. I'm going to go over some notes that you may have heard if you've attended more than one of these, but I just keep going. Please be aware that we are recording these sessions, except for the film viewing of Breaking the News. The recordings will be available for free in about a month on the SRRT website. After each session, the Zoom room you are in will end. If you have registered for multiple afternoon social justice sessions, so there's one more after this one, then you should have received a link to that one. Don't worry if you don't have a link, or if you'd like to register, you can go ahead and use the link that maybe somebody will put in the chat to register for the session that you're interested in attending. You should receive an email with the Zoom link to that room, which is, what happened. That's how you got here. Programs such as this are free for attendees, but they are a cost to ALA and SRRT. If you are interested in supporting SRRT and our work, then please consider donating at this other link that I hope somebody will put into the chat, or becoming a member of SRRT. You can specify your donation by roundtable and even make it a general gift, or select the SRRT task force or award that you would like to support with a direct contribution. We could not do great programming and work like this as a roundtable without your support, and we thank you very much. To enable captions, click more in the bottom right of the screen and then click Show Captions. If you have questions for our presenter, then put them in the Q&A in Zoom, and we will have time for discussion at the end of the presentation. So as I mentioned, this session focuses on patrons experiencing homelessness, policies, and parity. I'm excited to introduce our presenter, Mary Province. Mary Province, PhD, this is her little bio, is an assistant professor of social work at Ball State University and a licensed clinical social worker. In her early career, she spent 4 years as an outreach social worker on the streets of Indianapolis with youth experiencing homelessness. With 32 years of practice across the micro and macro spectrum, Mary is an avid researcher of the emerging field of public library social work as a response to homelessness. And now I'm going to turn it over to Mary. Mary, thank you for being here to share your expertise and your insights, and I look forward to it.
Thank you so much, Julie. Let me hit start, and hopefully this will. All right, can you all see that? Okay. I'm going to take that as a yes. It's good to see everyone today. My name is Dr. Mary Province, and as Julie said, I'm an assistant professor of social work at Ball State University, and I want to thank each of you for coming today for this discussion about patrons experiencing homelessness, policies, and parity. And I do want to say that not only my experience as an outreach worker influences my research, but I have been a lifelong lover of libraries. Some of my favorite memories are as a child living in small town Indiana. I also lived in rural areas as well, but I remember this one section of my childhood where I lived in biking distance of the library. And for those 4 years, I biked regularly to my public library and filled my little basket with books and read them voraciously. And so libraries have always been super important to me. And so I'm assuming most of you work in libraries, so I thank you all for your service. Most of my agenda today, I'm only going to spend about a half hour talking. And then after that, I really want to open up the floor for your input and insights and discussion so that we can all learn from each other. And of course, I'll be happy to answer questions as well. So the background of the study is I did a very large dissertation study a couple years ago, and I've had a couple publications published off of it since, but the information that I'm going to present today is a smaller subset of that larger study, and I've never presented it publicly before, so you're the first that get to hear this section of the findings. So today's research question that I'm talking about are how are library codes of conduct policies perceived to impact patrons experiencing homelessness? Now, I do want to make you aware that the original research question for the larger study was how does the role of public library social workers influence how public libraries respond to crises with library patrons experiencing homelessness? Now, this question that you see on the screen, though, was not one of my research questions, but it was on the mind of several of my participants. And as I did inductive coding, it grew up to be an important part of my study. So we're going to talk about that more today. So the purpose of the presentation is to really discuss how libraries can more closely align with Principle 9 of the ALA Code of Ethics, which is to recognize and dismantle systemic and individual biases, to confront inequity and oppression, and to enhance diversity and inclusion, and to advance racial and social justice. So I think that you'll find our conversation today hits on multiple of those facets. Now, it's no news to you that libraries are serving as daytime shelters for people experiencing homelessness, with a 7.4 million unit shortfall of affordable housing in our country and a lack of daytime shelters and the criminalization of homelessness in many of our cities. The libraries are being forced to serve as daytime shelters to people experiencing homelessness. Now, this is nothing new in terms of the history of libraries. We know well back for decades, people experiencing homelessness have been coming to libraries, but certainly in recent times, things are escalating. So in terms of just a very brief literature review, there have been a number of code of conduct policies that some researchers have identified as possibly negatively impacting patrons experiencing homelessness. I'm sure these won't come as a surprise to you, but there are things about no sleeping, no washing and bathing, not having large like sleeping bag rolls, no large items. And then also sometimes there's a lack of access to the library card itself if you don't have an address and therefore library materials. And sometimes those late fees that are not waived for non-returned items that then could bar further access to items. And what you'll notice is that as we talk about the criminalization of homelessness, you'll notice that some of these rules kind of loosely mirror rules that we see criminalizing homelessness in many of our cities, such as no sleeping in parks or no sitting or standing, those or no storing items in parks. So that's why I've kind of made this comparison. But again, I'm not accusing any library of criminalizing homelessness. I think I just want to open the conversation for each person that's here today to kind of think about their own library, what's working, what's not, and just to have a discussion, not any types of accusations, because certainly libraries have been asked to fill this incredible role that has been left in this vast lack of housing and a lack of a social service infrastructure in our country. And so you guys are being asked to fill this role that many of you did not sign up for. So real quickly, I want to highlight my methodology. I use an explanatory embedded multiple case study design, primarily using Robert Yen's method as a guide. I had 3 large urban central library locations that served as cases. And these were selected through criterion sampling. And some of the criteria including that they had to have a full-time library social worker that worked with patrons experiencing homelessness. And they had to be in a city of at least 100,000 or more. And I also made sure that there was regional representation so that I didn't have just a big cluster of of libraries in the same area. And then I also was looking to make sure that I had diverse racial representation of the social workers, because as you often know, oftentimes white social workers or white librarians get highlighted, and oftentimes people of color get left out. So I'm proud to say of the 5 library social workers that are represented in the study, 4 were persons of color. Prior to recruitment, I obtained IRB, and the data collection was from February to May of 2022. I had staggered start and end dates for each library, and I had a 48-day average in which I did the research on each library. Now, this was still in the height of COVID, and I was also a poor PhD student at the time. I didn't have any research funding, so I did all this through Qualtrics surveys and then recorded Zoom interviews. And also that's very unique to my study. I had about 9 different instruments that I developed for this because I really thought that each specific role that I interviewed needed to have their own data collection questions. And so I just realized I didn't really cover that in the prior slide. I had 6 subsystems of analysis at each library. So those were 6 different roles. I interviewed the social workers that also included any of their interns, front-facing library staff that ranged from checkout staff all the way to reference librarians, children's librarians, teen librarians, and so on. Then each library had a very different model of either library security or library policing, and they were involved. And then, of course, patrons experiencing homelessness were included, library location managers, and then the chief executive officer. So for the roles where there was just only one manager and only one CEO, it didn't make sense to do surveys with them. So I did interviews. And then with patrons experiencing homelessness, I had 3 at each library. So it made more sense to do just interviews. While the other folks, I had a lot larger numbers. And so I did do surveys and Zoom interviews for those. So now let's skip ahead. So the data analysis was very complex with 11 different steps. I'm not going to bore you with all of that today because today I'm just presenting some information from the interview findings. So you'll see there's step 9 where I highlighted the steps for analyzing the interview data, which included checking the transcripts for accuracy. And then I had a giant list of protocol questions. And as I went through each interview, I highlighted which information answered each of those questions. And I compiled them into these giant protocol answers for each case. And then I began coding each case. And I analyzed each case separately before I went on to the next one, and then the next one. And then I did a cross-case analysis. In addition, for the piece that I'm going to talk about today, I also looked at each library's code of conduct policies that were online, and I screenshot those so I had them of what they were at each library, and I used that in my analysis as well. So I do want to highlight, in terms of my analysis, what I'm sharing today is really going to be about the inductive coding portion, because I did not have any questions that asked them, hey, are there any policies that you think inadvertently affect people experiencing homelessness negatively? I had none of those questions. This was all inductive coding that came out because people were concerned about these issues and they brought it to my attention. And then part of the fun part of this study was I really needed to be tactile. And so here you can see some of my early processes of beginning to identify themes and codes. And if you see here where the circle is, I've identified codes that target PEH, or people experiencing homelessness. So early on, as I did the analysis, this was rising to the surface. Okay, I had multiple techniques for assessing trustworthiness and validity. I'm not going to go into those. If anybody wants to geek out after, feel free to let me know and I can go more into detail. All right, let's get to the findings. So there were 107 unique participants in my study, and that was 22 at case 1, 38 at case 2, and 47 at case 3. Now today I'm just focusing on the folks who did interviews. So there were 46 different folks who were interviewed. Now I do know that everybody that completed a survey was offered the opportunity to participate in an interview, and everybody who volunteered was contacted and given the option to interview, and most of those people did follow through on their interviews. In terms of demographics, I just want to highlight a few things. Now, this is the demographics for the entire set of 107 folks. Primarily front-facing staff were primarily white and female. Interestingly, the security guards, the social workers, and the patrons experiencing homelessness were more likely to be Black. In terms of the professional roles were, their mean age was in the 40s. And in terms of the patrons experiencing homelessness, their mean age was 50 across the 3 libraries. Okay, so how then are library codes of conduct policies perceived to impact patrons experiencing homelessness? Now this slide here is from my overall study with the larger themes that I had for my larger research question. I just wanted to show you where this is situated. So one of the themes that I found of how social workers are influencing how libraries respond to patrons experiencing homelessness was buffering. And then one of the sub themes was influencing how the codes of conduct are implemented. So that's where in the research, this piece about the policies started to come out. So each library had a very different authorizing origin for their code of conduct. Case 1 was in one of our largest metropolitan areas, and they were actually, their code of conduct was codified in county ordinance, which meant if the library wanted to change any of their policies, it could only be done by the legislative body. When I interviewed their CEO, he thought things were working pretty well, and he said he had no interest of trying to open up the can of worms to try to change their policies at the legislative level, and also felt like if they did that, then they wouldn't have the authority to handle some of the pretty serious situations that they had to deal with. I do want to say that case 1 had the only on-duty police, or actually they were off-duty police officers, but they were on duty at the library, and they were at the library every day as part of their security team. At case 2, it was also had a connection to the county, and other facilities within the county had almost identical codes of conduct. However, the CEO said that it was not part of the county code. However, this was a little different and was a little bit confusing. On their website, it said that they were authorized by a county executive rule that they could enforce people leaving from the library. And then case 3, their code of conduct was simply authorized by the library board, which gave that library much more flexibility. Okay, so no surprise, no sleeping was the one that probably came up most often in my research. One or more participants at each of the library mentioned that. I do want to say, as you see these quotes that I'm going to be putting on the screens, all of these names are pseudonyms in order to protect the confidentiality of the libraries and of the participants. So as you can surmise from this first quote, one of the social work interns was very upset that the police officers were waking up patrons experiencing homelessness. At case 2, Steve, who was a front-facing staff, talked about the logistical difficulties of waking someone up. You know, do you knock on the desk, and if they don't wake up, then are you supposed to touch them? You know, and that just felt very difficult to this person. And Steve described further that their staff had voted that this no sleeping rule had been voted by the staff as the most unfair, punishing, and not trauma-informed rule. And then at case 3, Jaden, also a front-facing staff, expressed consternation that the simple act of sleeping could escalate into a permanent ban from the library. And we'll talk more about how that happened. So I'll pause just for a second to give you time to finish reading those. So the no odor rule came up, and while only one person mentioned it, it was a story I won't forget. Tariq was an amazing human that I interviewed. His interview deeply impacted me as a researcher. And one of the stories that he shared that was so impactful was how a man experiencing homelessness had a very bad odor, and to the point that multiple other patrons were complaining. And so Tariq had to enforce the no odor rule. And he was afraid that the man would be angry or insulted, and maybe react badly. But instead, he described the sheer dejection and humiliation that this man experienced. And it deeply affected the patron, but it also deeply affected Tariq. He had not forgotten about it. And he described, both the physical pain of his stomach hurting, but also the emotional pain that he went through at having to enforce that rule. Lined up with that was the no bathing rule. And so this seemed counterintuitive from Steve, who was a front-facing staff at Case 2, and talking about how, hey, we have people who need a place to bathe and we have water, but yet we're not allowed to have them bathe. And he realized that this wasn't just an easy thing to figure out of like, sure, go ahead and wash, doesn't matter. He realized that there were safety issues in place and things that needed to be considered, but he definitely found it challenging. And then at cases 2 and 3 only, their codes of conduct had some bag limits. And Zoe, the CEO at Case 2, I was so impressed with Zoe. She was working really hard trying to mitigate this rule, trying to find help with other agencies or even a parking garage that was like near their library to see if there was a space where patrons experiencing homelessness could leave their stuff. Unfortunately, she came up empty-handed, but I really admired her for her attempts to solve this problem. There was also, Aaron and Jaden, front-facing staff at Case 3, they felt that the bag limit policy specifically was targeting patrons experiencing homelessness. And then Jaden talks about here about even a simple violation of having too many bags could escalate until someone was kicked out permanently. So I'll let you read that comment. So I want to go back to the codes of conduct themselves and talk about, they were each a little bit different. So this is taken from the library's websites. I'm not citing them because I don't want to violate the confidentiality of those libraries. But no, this did come from their websites. So the Case 1 had a level system, and level 1 violations were many of these rules. So the no sleeping, the no bathing, the odor, and usually it would just be an exclusion for the day if not corrected. However, if they had additional 1 violations or they would not correct it, then it could be bumped up to level 2. And at level 2, that would now result into a week-long exclusion. However, if a person now is at a week, okay, but they're still getting escalated, let's say they have PTSD, they got woken up, they're startled, they begin cursing, maybe they thrash their arm. Now with that thrash of the arm and something getting knocked over, now we're talking about possibly physically threatening behavior. And so a simple act of sleeping could then lead into at least a 1-year exclusion. At Case 2, it was somewhat similar. It was that progressive discipline procedure. The appearance of sleeping or inappropriate use of bathrooms ranged from being asked to leave after 2 warnings for the day, or even up to 6 months. And then odor or too many bags, they would be excluded until corrected. So basically, if somebody had maybe all their important documents in their bags, and maybe they had 2 or 3 bags, they would be excluded from the library until they could find some place to put them. At Case 3, the violations of sleeping, too many bags, odor, or bathing could result in being asked to leave. Refusal to leave could result in the police being called, and repeat offenders could be banned from the library. So across all the cases, even though the 3 libraries in this study really did try to resist calling outside law enforcement, violations of these codes of conduct could escalate and could result in arrest. Now, cases 2 and 3 were actively trying to make changes to decrease the a disproportionate impact on vulnerable patrons. But as you can see, Aaron is talking here. He's talking about how he feels like these rules were specifically put in place to help get people out quickly if need be, and that it disproportionately impacted those patrons who are homeless. And then at case 3, the CEO talked about that they looked at their data for the last 9 months, and they saw that the data showed that Black males were disproportionately impacted by the codes of conduct. And as you probably know, Black males are disproportionately represented in the population of people experiencing homelessness. Now, they were getting ready to trial some changes to their progressive discipline procedure in the summer of 2022. I have not followed up to see how that's going for them. And then at case 2, again, Zoe had reported that they were finishing up an equity review of their code of conduct to see which rules might be unfair to vulnerable patrons. So again, just want to acknowledge that all these, especially libraries 2 and 3, were really thinking about this issue of the disproportionate impact on patrons experiencing homelessness. And I really admired their efforts. Now, I want to talk about the patrons themselves. As I said, I did interview 9 patrons, 3 from each library. Now, these patrons were identified by the library social worker in advance, and part of the eligibility criteria was that sitting for an interview with me would not negatively impact their mental health. So that did probably influence on who was represented in that population that I talked to, or in that sample that I talked to. And ironically, the patrons overall did not have an issue with the codes of conduct. It came more that they felt like this was just part of the responsibility of being in the library, that you had to follow the rules. There was only one, which I'll get to in a minute, that did talk about some negativity regarding the code of conduct. So here you can see Clara, a patron at case 3. She really thought it was good that the library had made steps to decrease sleeping in the library in terms of how they arranged the furniture. And she thought that patrons experiencing homelessness should be using the library assets to better their financial situation and their housing situation. And so she really saw the library as a resource for bettering one's situation, not a place for sleeping. And then finally, the one patron that did identify that they had been excluded for a year said it was because they had gotten into a shouting match with another patron at the library. And then they also talked, and they didn't really seem to think that that was unreasonable. Like, they didn't diss the library for that, but they did return after their year was up. And one of the things that they did say is that sometimes there would be kind of a cranky security guard that would just kind of nitpick on the patrons experiencing homelessness about some of these rules. And so they didn't like that. All right. So just to go back quickly to that theme of the overarching study, which was that library social workers are helping libraries change how they respond to crises with patrons experiencing homelessness through influencing, one way was through influencing the code of conduct implementation. I just want to go over some of the ways they were doing that. So at case 1, a former library social worker, they had a new one now, but the old one had been credited for helping front-facing staff to be more gentle with patrons as they administered the code of conduct. At case 2, I thought this was so amazing. I had not seen this in the literature before, but the social worker had created a disability allowance. And what they did is a front-facing staff or security person saw that a patron, let's say, was talking to themselves in a way that was distracting to other people, they would bring that person to the attention of a social worker who could sit down with them, do an assessment, determine if they had a disability, and then figure out how they could use the library effectively, getting their needs met, but also respecting the needs of other patrons to have some quiet space. And so then they would write out that disability allowance that the patron would know about and that staff would know about. And that kind of decreased that angst that the staff felt about trying to enforce rules that maybe they thought was a little bit unfair. And it gave them a way, kind of a way out to be able to keep the space safe and usable for everyone, but also meet the needs of that patron. And then at case 3, the social worker had a director level position and was actually on the executive committee and was able to influence their changing progressive discipline to do that trial where they were going to trial a no sleeping rule to be a correct or leave offense. And then finally, and this was new in this research, that social workers at all the cases were serving patrons who had been banned. And I'd never seen this before in any of my research or any of relative research. And the way they did this varied. So at case 1, the social worker would serve banned patrons through email and phone call. Now, if they were a permanently banned patron, I don't think they served them. But if they were, banned for like a week or a month or 6 months, they would still serve them through phone call and email. At libraries 2 and 3, they partnered with their security team. And so, for example, if a patron showed up that had been banned and said, hey, I need to see the social worker, security would either walk them up to where the social worker was and stay with, in the area, monitoring the situation while the social worker met with them and then escorting them back out. Or they would call the social worker down to the lobby area, have them meet with the patron, and then make sure the patron left. So I was really impressed with those ways that they were still trying to make sure that patrons experiencing homelessness were having their needs met, even if they had gotten banned from the library. All right, so real quickly, I want to know some limitations. So because this was my dissertation study, I wasn't allowed to have any research partners to help me with the analysis. And I had 46 interviews, which was, for any of you who've done qualitative analysis, you know that that's just an inordinate amount. I also used to be a street outreach social worker. And so in order to try to mitigate any bias that I had, I did have several different practices of reflexivity that I did, including having an advisory committee, one who was a former public librarian that I would often talk to and bounce my ideas off of, and just to make sure that I wasn't being biased. This was limited to U.S. urban libraries during COVID and right after the George Floyd murder. So it was during a heightened time of people being very concerned about many aspects. And it was based on qualitative interviews and perceptions versus any kind of quantitative data. And then this subset of the data, as I said before, this idea of these policies came through inductive coding. I didn't ask any questions that targeted this. So I only have in this information those participants who brought it up themselves, rather than a full display of what all 46 interviewees thought about this issue. I do want to talk a little bit more about the disproportionate impact. So Vitale is a researcher that talks about the criminalization of homelessness kind of in the broader in the broader sphere. And he talks about that even if we as a society enforce our laws equally, it doesn't consider that those folks with less financial resources are more likely to break them. So an example would be that, if a person is in poverty, they're more likely to drive a car without having car insurance than someone who is middle to upper class who has the ability to keep that coverage on their car. And so because of that, they are more likely to suffer legal consequences for the breaking of that rule, more so than someone with more financial means. And just like that applies in the public sphere, it also applies at the library. So a person who is unhoused is more likely to break the sleeping rule, because perhaps all the shelters were full, or perhaps they didn't want to stay in the shelter because I know, like in Indianapolis, one of our main shelters has religious criteria that they have to sit through a sermon. So maybe they didn't want to stay at the shelter, even if there was space. And so, maybe they've been walking all night or riding a bus all night. They're exhausted. So it makes sense that they are going to be the ones to break a rule of no sleeping in a library. Same thing with lack of access to showers and so on. They're going to be more likely to break those rules. So even though libraries try to enforce rules equally amongst all patrons, even so, it can still disproportionately impact a patron experiencing homelessness. And some of the front-facing staff in this study really felt like the code of conduct made it harder to help those patrons, in some cases even made it worse. And they were really concerned about that these simple sleeping violations or even bag policies could escalate very quickly, and that these sometimes could lead to arrest. So I just wanted to acknowledge this balancing act that libraries are in, trying to create a safe space that's inclusive for everyone, and versus the possibility of criminalizing, and that the progressive nature of these policies can lead to multi-year or permanent bans. And to think about the idea of, certainly I heard many acts of violence in my research, and certainly if a patron has, done certain acts of violence or threatened people, those may be very valid reasons to issue bans, versus though, do we really want to ban people for sleeping? So these are kinds of things that I just want to open up for discussion here in a few moments. I'm not saying I have all the answers, I certainly don't, but I think it's good to have the conversations about this balancing act that public libraries are in. So I did a lot of literature review to see what ideas are out there, and then some of the ideas are also from my own work as a macro social worker. So some of the ideas of how libraries could consider to minimize the risk of criminalizing homelessness is to do a needs assessment of patrons experiencing homelessness and just really learn about what needs are presenting at their library and seeing what they might do to then answer some of those needs. The ALA had a great suggestion of having an advisory committee of unhoused patrons for policy input. I love that. Ruhlman, 2014, even had talked about libraries having a policy to allow sleeping as long as it didn't impede others' use of the library. And basically what they meant by that was if they were snoring really loud, yeah, you should wake them up because it's probably disturbing other patrons. But if they're just, sleeping quietly, they're not disturbing anyone, to leave them alone. Now, this one's a stretch. In academic libraries, there have been use of napping pods for 20-minute naps. Now, I know this could present some logistical considerations, but I just thought it was something out there to promote conversation. Also, the author Blood of 2022, they just advocated the outright ban of doing away with odor rules. Again, I'm not suggesting that that's an easy answer. I know that that probably is a controversial suggestion, but it was in the literature. And then consider the result of the conflicting policies of having no odor, but yet not allowing people to wash up. And then in terms of that washing up piece, one of the ideas that I had is that, so in the population of people experiencing homelessness, one of the largest groups that's rapidly expanding is people over the age of 65. And so as they age into Medicare, many of those Medicare Advantage plans, which can be free, have free gym memberships as a part. So depending on your location, that may be something even if you don't have a social worker, perhaps you have a social service agency that's coming in once a month or once a week to help people, sign up for benefits. That could be something, to really target helping people to sign up for those Medicare Advantage plans and helping them sign up for a gym membership, so that they have a place to not only exercise, but to stay clean. For those of you familiar with San Francisco Public Library that are credited for having the first full-time public library social worker, they do the mobile showers through a partnership with Lava May. And I know those mobile showers are a possibility, and Lava May's open for partnership. I'm sure that would probably take some grant money, but it's something to consider. And then the Philadelphia Free Library, they partnered with a supportive housing agency who housed people who were formerly homeless, and they hired the folks in the supportive housing to serve as bathroom attendants in the library, to help clean up after, if people were, bathing or shaving or brushing their teeth, those attendants made sure that the bathroom was still clean and hygienic for all patrons to use. And then, libraries are key institutions in their communities and usually have some influential CEOs and board members. And so using that leverage in the community to advocate with social service agencies and public pools, maybe seeing if you can leverage a partnership, because I don't know, depending on where you live in the country, I know in Indianapolis, we have public pools facilities all around Indianapolis, and those showers stay dormant for 10 months of the year. And so what kind of partnerships could be developed to maybe have social service agencies that are accessing those public pools for showers for patrons experiencing homelessness? And then also to encourage collaborations for daytime drop-in centers. We have a severe lack of daytime drop-in centers in this country. As you probably know, most shelters close down at night. Close down during the day, and people are forced to leave. So to advocate for daytime drop-in centers to fill some of that gap that libraries are having to fill, but rather, can we have a drop-in center where people can take naps, take showers, have storage, etc. And then finally, on a really larger scale, to advocate for a homeless bill of rights in your city or state to help decrease that criminalization of homelessness. So that's all that I have. I want to open up the floor to find out not only questions that you have for me, but what have you found that works in your libraries, and just to share tips with each other. So I'm going to end my slideshow and then just open up the conversation. And Julie, if you'll help, of course, moderate, that would be great.
Thank you very much, Mary. That was really great. Before you start your conversation, I do want to, you have two questions in the Q&A, so I can read those to you. Are you ready?
Yes, thank you.
Okay. The first one is, I thank you so much for your work. I want to know if any of the libraries that you visited had wellness stations or provisions for people experiencing homelessness. I run a small one at my small library, and I find it worthwhile.
I did not hear any mention of wellness stations, but I did know that one of the libraries had a partnership with, it was either a mental health provider, or no, I believe it was a medical provider. And so patrons could make an appointment to meet with a medical provider through telehealth. And even one of my patrons experiencing homelessness talked about how it prevented her from having a crisis, because she was almost out of her psychotropic meds. But the social worker got her matched up with this telehealth group. They got her prescription, got her meds before she ran out, and she avoided a crisis.
Great. I don't want to mispronounce your name. Milena, does that answer your question? And did you want to say something about what you're doing? No?
Sure, I can come off mute. Hi, I'm Milena. I work at the Highland Park Public Library in New Jersey. And I run just a very small wellness station that gives out pretty much everything: tampons, any kind of menstrual products, masks, COVID tests. Right now we have some Plan B, condoms, anything like that we can get. Everything is free and through donation. And I also do, I am in no way a researcher myself, but I do present on working with homeless patrons myself on a state level, talking about wellness stations. And then the president of NJLA actually runs like homeless wellness groups where homeless patrons get together and talk about their needs and how the library can help them, which is incredibly beneficial. But this is amazing because I haven't seen any studies about it done. So yeah, thank you.
Thank you.
Thank you. I will say that many library social workers do keep hygiene supplies and, coats, hats, things like that. So a lot of social workers have those kinds of resources available. But I love your idea of the wellness stations. Thank you for the work that you're doing.
All right. And the next question is from somebody anonymous. Would someone be able to provide a link to the story about the napping pods? I'd like to learn more about how they work. And also they thank you for putting this workshop together, or maybe I don't know. Anyway, thank you.
Yes, I have the napping pods link. I'll try to put it in the chat pod if you give me just a second.
There, see. And then maybe while Mary's doing that, the next question is, I think you said this is your dissertation. Is it published online?
It is right now. I have it in what do you call it? Embargo. Is that the right word?
Yeah.
I
think
have
so.
it embargoed, so you can't access it if you can look for it and find it. But you'll have to go through my home library of of Indiana University to get permission, and it'll come to me, and then I can approve it. I'm doing that because I'm still doing a lot of publishing off of it. However, I do have 2 studies. The main findings have already been published. And you can find those by searching my name, and they're in a journal from Australia. So they don't have public access yet, unless you have access to that journal, but I'm hoping to pay the fees so that those can be more widely available. But if you want it, you can also email me and I'll send it to you.
And we have your contact information, or do you want to put your email in the chat?
Yes, I'm trying to find.
Do you want to stop sharing your screen so we can see everybody, or do you still be referring to it?
Yeah, hold on.
Okay.
There we go. Now I can see the chat. Yeah, I'll put my email address here.
Okay, great, thank you. Let's see. All right, those are the questions that came up, and then in the chat, just somebody said, great presentation, thank you. Let's see. Any other, there's a new, that's probably you. Let me see. Yeah, it's your email address. Any other, I can't remember what time this is supposed to end, April or Derek or somebody.
30 after.
30 after, okay, oh, good way of acknowledging we're all in different time zones.
I'll ask a question.
Oh, good.
I always have questions. I'm assuming you chose this topic for your dissertation because you had an interest in it, and maybe you talked about like with your biases. Did you walk away from this research with a new outlook on anything?
Oh, absolutely. Absolutely. I had already, I came away with just a new appreciation for libraries and librarians and the very difficult work that you do. I entered social work, and specifically my work on the street, knowing that I could face physical danger, and purposely putting myself in situations, in tunnels and crack houses and all kinds of stuff. I purposely put myself out there to access people experiencing homelessness. And yet I had not experienced any of the danger that the librarians that I interviewed had been through. And so I just walked away with a huge amount of respect. And also just every interview was a gift. The people who chose to be interviewed. Now, like I said, everybody had the opportunity to be interviewed, but the people who actually chose to be interviewed, they really, really cared deeply for their patrons experiencing homelessness. It just was really meaningful to me.
How did the patrons feel about being interviewed? Were they glad someone was listening to them, or?
Yes, very much so. I really, really enjoyed those interviews. They were also a gift, and they felt, I think it made them feel really important to be included. And certainly that is a limitation of most of the research around library social work and around libraries in general, is that we often don't include patrons experiencing homelessness in the research itself. So that was a priority to me in this study, was to make sure that their voices were represented.
Thank you, Mary.
Does anybody have ideas to share about how your library has tried to make these codes of conduct a little more, I guess, amenable to patrons experiencing homelessness, or any ideas? Because I'm certainly not an expert on all the solutions out there.
Oh, looks like Brian has his hand up. Brian, you want to go ahead and speak?
Yeah, can you hear me?
Yes.
Yeah, I think one idea that we did at San Francisco Public was, facilitated by our social worker team. They just train staff on the resources they offer. So that really helps to kind of connect everyone to these resources that are offered in our library. Um, and a lot of staff members didn't even know that we were offering those resources. So it was really good, especially when you're dealing with lower classifications, not just librarians, because oftentimes lower classifications are the ones that, are the frontline staff members that are impacted by these issues.
Mhm.
Great, thank you.
Yeah, one of the things that I knew that social workers often made lists of resources to give to librarians. And conversely, I know a lot of you guys developed those resource guides too. But what I found out was that the social workers in these libraries were making them very detailed. Like, okay, if a person walks in and they say this, and this is the first person you call. And if you call there, you need to ask for this person. And if they don't help you, then you go to this next person on the list. So it was that very in-depth, like that social workers know how to do, but yet one of the really only complaints that I heard about the social workers were that they weren't there all the time. And the front-facing staff and the librarians were. You guys are there all the hours of library operation, whereas social workers only have representation, maybe 34, 40 hours a week. Sometimes social workers are called to multiple different branches. And so one of the ways that social workers were influencing this response to crises was providing these really in-depth guides to front-facing staff, and also doing a lot of training, as you said, Brian, on a lot of different topics, which was super important.
Yeah, I think I know that when I was doing my research, one of the things they talked about was warm handoffs, where you don't just give somebody a phone number or a piece of paper that has resources, but you actually contact them. You have a specific person, which sounds like is in their list, their very detailed list. The other thing that I found was that it's really important to keep checking the resources, because they can go out of date really fast. So
yeah, and that's a great use of social work interns' time. If you aren't able to afford a social worker, but you have a social work intern, that's a really great task for them to do.
that's great point. You have a comment in the chat. Let's see, make sure I didn't miss. We subscribe to Niche Academy and watch Ryan Dowd trainings to help de-escalate conflict and lead with empathy when interacting with patrons, especially with the unhoused. We don't have a social worker, but we just hired a community connector this year. This is Katie Harness-Hemmer.
Okay, great.
I can contribute something. I ran a human library. We did a human library in Knoxville several years ago, and the books, I don't know if people are familiar with human libraries, where you check out a person instead of a book, and then you sit down and talk to them. And we did it with people who are unhoused, and they got so much out of being listened to. It was a one-on, somebody would check them out and sit down and listen, talk to them and ask them questions and listen to them. And they were just really thrilled at being treated like anyone else, and if their story was worth hearing. So that's another thing you can do.
Yeah.
Any other suggestions or comments from people or questions? It's a lot of material you've covered. Oh, let's see. New message. Did you offer any kind of, when you did the groups, did you offer any kind of like gift card or anything for people? Or did you interview people one-on-one, or did you do focus groups, or did you do both?
No, they were all individual interviews. I offered $10 Subway gift cards to the patrons experiencing homelessness. or maybe it was 15, I don't remember, but it's been a while. But the way I did that was I mailed them to the social worker ahead of time so that they could, you know, after the interview was done, they could go to the social worker and get that card. So that's how we worked that out.
It's great. Yeah.
I do hope in some of my past research, when we did a needs assessment for a large Midwestern library, Beth Waller, who many of you may be familiar with, who's one of the leading researchers on this area. And for that research, I was the one that went out and actually did the direct patron interviews on the ground at multiple branches of that library system. And it was very, very meaningful. You know, it's much more meaningful to do those interviews in person. But like I said, my dissertation research was situated during COVID, so that wasn't possible.
Great. I actually have another question. I think we've got a couple more minutes, and that's, did this topic of safety or security come up a lot?
Yes, that's a whole big piece of my dissertation. Yeah, so one of the things that I looked at was the security model at each of the libraries. And so I have a lot of information about that in my study because they all had very different models of security. And then I also talked a lot about the different things that they did as a security teams, because they did differ from security teams. And one of my there was also a big part of it about the perceptions of safety, because again, I didn't ask people, you know, hey, have you ever had a violent act happen to you at the library? But this just came out. Librarians and front-facing staff were talking repeatedly about safety issues at the library. So that too is going to be in future publications that come off of this study.
Yeah, that's great, because that came up in my research, and what I've been thinking about lately is that everybody has a different version of what feels secure or safe to them.
Yes.
So for example, if a police officer with a gun walks into a room, I feel unsafe. I feel less safe than I did before they walked into the room with that gun, but some people probably feel safer. So I think
Yes.
that the whole idea of what makes a person feel safe or secure is so individual, and yet we act as if it's just a term that everybody feels the same, like security is the same for everybody, but it's not.
Yes. Yes. And what was really interesting and was that this idea around safety and that veers into what is a crisis. So I specifically did not define crisis for the study because I wanted each person to answer the question about crises as they perceived crises. And so what I found was really, really interesting, that among librarians and front-facing staff, that a crisis could be somebody crying, could be strong emotion. So it could be anger, it could be weeping. Whereas when I interviewed the social workers and they gave their examples of crises, not one of the social workers talked about strong emotions being a crisis. And so I think that really speaks to our training, right? I mean, social workers are trained to deal with emotions, librarians are not. And so again, not that one is better than the other, but we're different. And, you know, there are many aspects of our roles that we need to clarify and understand and appreciate and value about one another, because I really do feel like not only that librarians and social workers are, you know, need to continue to work on this collaboration, but also policing and security, because in libraries that have enacted a social worker without a good alignment between the three professions, all three, we get silos, and then people get disgruntled, and you know, things don't go well, and social workers feel isolated, and librarians feel let down that, hey, you were supposed to solve it, you didn't solve it, and you know, the security guards are still doing their thing, and the social workers getting mad that patrons are getting arrested. So we have to have this cooperation. And so the libraries in my study were all well-established programs, and they really worked very closely with their security teams. And there was a clear process of how they were accessed. Almost everybody knew how to refer to the social worker, and almost everybody had. If you want to read about that, actually, I can cut and paste those studies in the notes if you want, or you can email me and I'm happy to send them to you. But those things have already been published.
Right, thank you. I think we're out of time. Is that right, April?
Okay.
Yeah, unfortunately.
Yeah, so people have your email address, so it sounds like if they email you, you could send that information to them or any other questions they might have that they didn't come up with right now or that they think of later. Thank you so much. This has been really great. Great meeting you, Mary.
You too, Julie. I can't wait to talk to you more.
I know. You could see, everybody could see we have a lot in common, so. All right. Okay.
If you're able to stay on, we can exchange contact information if you want, or even schedule a meeting.
Yeah, is that something we could do once this? How does that work, April? People are saying thank you to you.
Thank you all for coming.
Yeah, I think April already jumped off,
Oh, okay.
so I can hold on if you want.
Okay.
He's setting up the next session because it's on a different link and all that.
Okay. All right. Thank you, everybody, for attending. Sorry, I should have said that. It's been, I'm glad you.
Wow, do you know how many we had?
Yeah, at our high point, we had 35 participants.
Great.
But this thing's recorded, so there's going to be a lot of people viewing it later. We just like our other 4 years of afternoon social justice. There's a that always seems to get